Good evening, class. We are going to continue from where we stopped the last time, or in the last video, or the previous video. We ended with the pathways of drug transports, where we said we have the direct penetration going through protein channels and also by means of carrier proteins. So this is what we looked at in our previous videos. Today, we are going to look at processes that determines absorption. So we are looking at processes that determine absorption. And with this, we are looking at the physiochemical factors. What I mean by the chemical component of the drug or the makeup of the drug sometimes affect how drug gets absorbed. So we are going to concentrate on that, especially on the chemical factors. And then later, we will also look at the biological factors that affect absorption. So with the physiochemical factors, the first thing that we are looking at is drug solubility or the solubility of the drug. And from what we learned in the previous video, we said due to the nature of our cell membrane, only lipid-soluble substances can go through. Due to the nature of our cell membranes, only lipid-soluble substances can go through. And because of that, drug must be lipid-soluble in order to penetrate through the cell membranes by themselves. So the lipid solubility of the drug determines its absorption. Then the next one is the nature of the drug. Most drugs are either made up of weak acid or weak bases. So you'll get this. So the nature of the drug also affects absorption. Then the pH of the media, so the pH of the stomach or the intestines also affect absorption of drug. Then the molecular size also affects what absorption. So from the previous video, we said drugs with the smallest molecular size can diffuse or penetrate through the cell membrane by themselves. So this means that when a drug molecular size is big, going through the cell membrane by themselves will be what a problem. So they will need some form of a transport mechanism to help them through. So that is the molecular side. And the disintegration or dissolution of the drug or the formulation of the drug. So how some drugs are formulated sometimes affect absorption. Okay, lipid solubility of the drug. What do we mean? Drugs which are lipophilic. Lipophilic means lipid loving, so lipophilic. And we have hydrophilic. Hydrophilic means what? Water loving. So drugs which are lipophilic, or some people say lipophilic, it means they love what? Lipid. So once the cell membrane is lipid and the drug has been formulated in a lipid form, it means when you swallow the drug, crossing the cell membrane wouldn't be a problem at all. So lipophilic or lipophilic drugs can cross cell membrane. This means that lipophobic or drugs that don't like lipids or drugs that can dissolve in lipids cannot cross what? Membrane. So the next sentence I said drugs which are lipophobic or hydrophilic have problems crossing what? Membranes. So that's the first thing that you're supposed to do. Drugs which are lipophilic can cross membranes. So this means if the drug is lipid soluble, crossing the membranes isn't a problem. But drugs which are lipophobic or hydrophilic, they have problem crossing the membrane. So that's the first thing that you have to know. Then the nature of the drugs. Over here, I want you to pay small attention. You're supposed to be doing some chemistry, but I wouldn't want to go so much into the chemistry. And I will try as much as possible to explain this in the simplest way that I can for you to grasp it. Okay, most drugs are either weak acid or weak bases. Most drugs are either weak acid or weak base. So that's what I want you to first take note of. The drugs that are produced, most of the drugs are either weak acid or what? A weak base. So that's the first thing that I want you to take note. And because of this nature, the drug have two parts. we have one part that carries a charge and another part that do not carry a charge. So we have one part that carries a charge and the other part that do not carry a charge. And what did I say about charged molecules? We said charged molecules cannot diffuse through the cell membrane. Only the uncharged molecule can go through cell membrane. So first thing that you have to note is most drugs are either weak acid or weak base. And because of that, they have two parts. You have parts which is ionized. Ionized means they carry charges. And we have parts which is unionized. Unionized means they do not carry any charge. So drugs have two parts due to the nature, and because of that, we have a part which is ionized and we have a part which is not ionized. Okay. So the ionized portion is charged, which attracts water molecules, that's forming a large complex. So we said charged molecules cannot diffuse through membrane. So the ionized portion of every drug carries a charge. And the non-ionized portion do not carry a charge. So because of that, they are lipid soluble. Don't get confused. So the drug, we have weak acid and weak bases. And per their nature, because of how it has been formulated, I don't want us to do a lot of chemistry over here, but because of how the drug has been formulated, we have a part that carries a charge and we have a part that do not carry a charge. The part that carries a charge is water soluble, and the part that do not carry a charge is lipid soluble. That's all what I want you to graph over here. Okay, so now let's move on and let's see something. So only a non-ionized or a non-polar or undissociated drug can enter or can cross cell membrane. What we are saying is it's only the part which is not charged, which doesn't carry any charge. Those are the drugs that can cross cell membrane. So only a non-ionized or a non-polar or undissociated drugs diffuse across cell membrane. Okay, so non-polar drugs are lipid soluble. Non-polar drugs are lipid soluble. Okay, so non-polar drugs are lipid soluble. Polar drugs are water soluble. So all what I am trying to say is drugs have two forms. We have the ionized and we have the unionized form. And per how it has been designed, it is only the non-ionized form that can cross cell membrane, because the non-ionized form doesn't carry any charge and they are lipid soluble. Okay, and we'll get to know why we are trying to do all these things. Okay, so now let's move on. So the more lipid soluble a drug is, the more absorption. And the more water soluble a drug is, the more excretion. So what we are saying is when a drug is carrying a charge, it becomes more available for excretion. And when a drug does not carry a charge, it becomes more readily available for absorption. So someone will ask, so what are we doing? We are here to learn pharmacology. So why all these things? Now let's look at the pH of the media. We said the pH of the media too can do something. Okay. So this is it. Drug that carries charges can't diffuse through cell membranes. Drug that do not carry charge can't diffuse through cell membrane. Okay. And I said drugs are either weak acid or weak bases. So why are we learning this? This is a simple way, or the reasons why we are trying to do all these things. Now, the pH of our stomach is acidic, right? So the pH of the stomach, some book will say it's 1.5 to 2 and all that. So it means the pH of the stomach is highly acidic. And what does that imply? When you take a drug like aspirin, aspirin is a weak acid drug or weakly acidic drug. So when you take a drug like aspirin and it gets into the stomach, Because the stomach concentration is more acidic, what happens is, as like the aspirin gets into the stomach and they remain unionized. All what I want you to know is when an acid gets into an acidic medium, they remain on what? Unionized. And if a drug is unionized, what are you trying to say? We are trying to imply that the drug will be what? Absorbed. So when you take in aspirin and aspirin gets into the stomach, because of the pH of the stomach, the aspirin remains unionized in the stomach medium, and that will enhance absorption of aspirin from the stomach. So theoretically, that's what we are trying to say. So when you take acidic drug and it gets into acidic medium, the drug remains unionized or uncharged. So the unionized portion of a drug is what? Lipid soluble. What happens when the drug gets into a basic medium? So when acidic drug enters into the basic medium or the small intestines, let's say the basic medium, acid in base, they will be charged. Acid in acid, they remain uncharged. I just want us to use these simple terms in understanding. So acid in acid, they remain uncharged. And if they remain uncharged, absorption will what? Happen. Acid in base, it will be what? Charged. They will be carrying charges. And once they are carrying charges, they can't be absorbed. So it means what? Excretion. So acid in acid, what? Unionized or uncharged, hence absorption. Acid in base, they will be what? Charged or what? Ionized, hence what? Excretion. Okay. So these are some few questions that are asked. Acidic drugs are better absorbed in acidic medium. Why? Acidic drugs are better absorbed in acidic medium because in acidic medium, acidic drug remains uncharged or unionized, or they don't carry any charges. And I said uncharged or unionized form of a drug is better what? Absorbed. So acidic drug is better absorbed in acidic medium because in acidic medium, they remain unionized or what? Uncharged. Some people will also say undissociated. So because of that, they can be what? Absorbed. Basic drugs are better absorbed in basic medium because in basic medium, basic drug remains uncharged. So acid in acid absorption, base in base absorption. Acid in base, when acid goes to a base environment, there will be what? Charges, so it will be what? Excreted. When a base goes to acidic environment, there will be what? Charges, so they will be what? Excreted. So this is all what I want you to understand. Acidic drugs are better absorbed in acidic medium because in acidic medium, the drug remains uncharged, hence absorption. Basic drugs are better absorbed in basic medium. This is because in basic medium, the drug remains what? Uncharged, and hence absorption. Acidic drugs are better excreted in basic medium. Why? Because in basic medium, the drug remains charged, and hence what? Excretion. And basic drugs are also better excreted in what? Acidic medium, because in that medium, the drug remains what? Charged, and hence it will be what? Excreted. So this is what I want you to understand. Okay. So someone will ask, why are you doing all these things? Let's look at something. In case of acidic drug poisoning, so let's say in case someone takes overdose of, let's say, aspirin, and you want to get the drug out of the body, what do you think we can do to get all that drug out? We know that acidic drug can be better excreted in what? Basic medium. If you want to get acid drug out, you have to change the pH of the environment to be what? Basic. So when someone takes overdose of aspirin and we really want to get the drug out, we have to increase the plasma pH. Although the blood pH is 7.4, so we can give a drug that will increase the pH of the blood. And as the blood becomes more basic, the acidic drug will be extracted from the other components of the body, and it will be what? Excreted. Because acidic drug in basic medium, the medium will make the drug get charges, and charged particles cannot what? Be absorbed. You get it? So in case of acidic drug poisoning, we call something alkalization. We increase the pH of the medium. So increasing the pH means you are making it more basic. And if the pH becomes more basic, acidic drug will be excreted. So in case of that, we do alkalization to promote what? Excretion of that drug. Increasing the plasma pH will cause weakly acidic drug to be extracted from the CNS into the plasma and accelerate their what? Excretion. So please do get it. So all what I'm saying is, if you take overdose, or if someone takes overdose of a drug and we know the pH of the medium and we know the nature of the drug, all what you can do is to just manipulate the pH to be able to get the drug out. Okay, and in case if you want to get a drug absorbed and we know the pH, if the pH of the drug is maybe 3, 4, 5, and we want the drug to be absorbed, we can change the pH of the plasma by giving a drug that will make the blood pH becomes a little acidic, and that will also enhance what? Absorption. So this is all what I'm trying to say. So when someone takes acidic drug, poison or overdose of any drug, and we know the pH of the drug and all that, we can change the pH of the environment to either enhance excretion of the drug or excretion, absorption or what? Excretion of the drug. Okay. Now let's look at the next thing. In case of basic drug poisoning, we acidify the environment. So in case someone takes overdose of diazepam, and we know we can find a way of clearing the drug from the system. And what are we going to do? Diazepam is a base, and basic drugs are absorbed well in basic medium. This means that if the pH of the environment is more basic, absorption will happen. So what you can do is you have to change the pH of the medium. So you can give ammonium chloride. Ammonium chloride is more acidic. So it will go and change the pH of the medium, and that will enhance what? Excretion of the drug. So please, I hope we get it over here. So we said, in a nutshell, what I've said is the nature of the drug affects how drugs get absorbed, and also the pH of the medium also affects how drugs either get absorbed or get excreted. And we said most drugs are either weak acid or weak bases. So weakly acidic drug and weakly basic drug, they have two components. They have part which is ionized. Ionized means they carry charge, and part which is what? Unionized. And we are saying that the unionized portion of every drug is what? Lipid soluble, because they are not carrying any charges and they are more lipid soluble to be what? Absorbed. And we said the ionized portion are water soluble because of the charges that they carry. So this is what we said. And we came to the pH of the medium. And I said acidic drug, when an acidic drug gets into acidic medium, most of the time the drug remains unionized, meaning they don't carry any charges. So if a drug doesn't carry charge or a compound is not carrying any charge, what happens? Absorption. So that's what we say. So acidic drug in acidic medium, the drug wouldn't carry any charge, hence absorption. Acidic drug in basic medium, the drug will break down to various components carrying charges and hence excretion. So this is what we have done so far. For the sake of objectives and some other things, take note of what we just did. Okay. Then we are going to look at the host or biological factors affecting absorption. So what we looked at previously was the physiochemical factors. Now the host factor, the human factor. So what is it? The route of drug administration. The route that we choose will determine whether a drug will be absorbed well or not. So when you choose route like IV are placing the drug directly into the bloodstream. So with that, all the drugs are going. But when you choose a drug like the route, like the oral routes and others, sometimes it affects how drug get absorbed. Okay, so the route of drug administration affects absorption of what drugs. That's the first thing. The next thing we are going to look at is the molecular size. So the molecular size of the drug will also enhance what? Absorption. If the drug size is small, absorption. If the drug size is big, it can't go through, then you need help. Then the presence of food. Presence of food can either enhance or delay absorption. It depends. So presence of food. So there are times they will tell you, take this drug with food. Do not take this drug with food. So all the instructions that they give regarding to drug and foods, they have reasons. So we shouldn't just assume that or any drug and take any drug with food. There are some drugs, when you even chew it, you destroy let me use the word, how the drug was made, and sometimes affect how drug even work. So presence of food can either enhance or delay absorption. The presence of food in the gut around the time of drug administration can affect the degree of absorption. Nutrient molecules compete with drugs for site of absorption. So sometimes the nutrient in the food will compete with the drug for site of absorption. As a result, the plasma concentration can be lower, and as the drug action is more prolonged. But there are some drugs too, they are better absorbed with food. So please, let's take note of this. Okay. If not, that the patient might be taking a drug and the patient will say the drug is not working, probably because of the food and other things that the patient has been taking, they affect how drugs get absorbed. Then that also affects the plasma concentration and thereby affecting how drugs get to the target site to work. So presence of food. So the presence of food in the stomach influences the absorption of many drugs such as iron, antimicrobial agents, and nifedipine. The presence of food in the stomach may reduce nausea associated with some drugs such as iron and aspirin. So food does a lot of things, but sometimes it can affect absorption. At the other time, it can also enhance absorption. So practice point, iron is best absorbed in its ferrous form. So iron, we have some forms of iron, and it is best absorbed in this form, the ferrous form. However, this is converted to less soluble ferric form if the gastrointestinal contents are not acidic enough. So ions are better absorbed in the ferrous form, and the stomach acid content helps, like in this conversion, making sure iron gets absorbed in the ferrous form. So sometimes with pregnant women, when they are going to take their iron supplement or tablet, we tell them to take it with vitamin C or tomato juice and all that, because those will create an acidic environment that can enhance what absorption. So please take note of that. And the nature of the surface area, the more extensive the absorption or the absorbing surface area is, the greater the absorption. So drugs are better absorbed in the small intestine. When you take your intestine, those of you who like imuadie, you go and buy the who you say, Mami, imuadie, then you point in near aquanquano. Yes. When you take the small intestine and you spread it, some will say it's like the size of a long tennis court. This means that it has a large surface area. So most drugs get absorbed in the small intestine. So the more extensive the surface area is, the more absorption. So take note. Then blood flow to the site. The more blood flow to a particular site, the more absorption. So when you give a drug at the subcutaneous, because of less blood supply to the extremities, absorption mostly takes time. So absorption is slowed. But when you go a little bit into the muscles, blood flow to the muscles are greater than the extremities. So blood flow to an organ or to a body part enhances what? Absorption. And let's look at some practice points. During pregnancy, the peripheral circulation is dilated, which may enhance absorption of drugs given by subcutaneous or intramuscular injection. So during pregnancy, circulation to the peripheries mostly go up, and that affects absorption. So if someone is pregnant and you give the person insulin, just know that the insulin will get absorbed rapidly because of what? Increased circulation to the peripheries. This means that the person might be what? Might be a candidate for what? Hypoglycemia. So when someone is pregnant and the person is taking this insulin, we have to be monitoring because of the increased circulation. The drug gets absorbed more, which can lead to what? Hypoglycemia. So we should be monitoring pregnant women who are on what? Insulin. If not, they can go into hypoglycemia and you wouldn't be able to do anything. So let's take notes. Then there are sometimes effects of disease. Some effects of disease in the gastrointestinal way sometimes affect absorption. So when you have disease like when you are vomiting, when there's diarrhea, when there's constipation, all these things affect what? Absorption. And I want you to find out how this, maybe how diarrhea and constipation affect absorption. Maybe in our next class, I will find out how diarrhea and constipation affect absorption. One will enhance absorption, the other will prolong absorption. So I want you to find out. In our next class, I will ask. The effect of pregnancy, when people get pregnant or when women get pregnant, there are so many changes in their system, their hormonal system. There are so many changes, and this mostly affect absorption, especially when you get pregnant or when you are pregnant. There's erratic secretion of gastric acid, so the acid content goes up. So this means that when you take acidic drug, the drug is going to be absorbed faster, because there's rapid secretion of this agent. Also, peristaltic activity sometimes is also slowed. It's been sometimes during pregnancy, most people get constipation and all that, and this affects absorption. Even though I brought some practice points, but I want you to find out how maybe constipation or diarrhea affect absorption of drug. So the decline in gastrointestinal motility, which is associated with pregnancy. So during pregnancy, the decline in that activity, and most there's constipation, and that delays absorption. And I want you to go and find out why. Then effect of exercise. You know that when you exercise, you increase blood circulation to part of the body, and that also enhances absorption. So once someone takes, let's say, a deep IM injection and the person suddenly starts jogging or walking, there's increased blood supply to the surface that enhances absorption of drug, and hence the drug will start working very, very rapid. So let's take note. Then the degree of acid in the stomach, as I said, the pH of the medium affects absorption. So if you have acidic medium and you take acidic drug, absorption. If you have acidic medium, then you take basic drug, most of the drug will be excreted. So this is all what I want you to know. Then before a drug can be absorbed, it must first dissolve. Drug formulation that allow rapid dissolution have a faster onset. So how the drug is formulated sometimes affect how drugs will be absorbed. There are some drugs, they have been formulated in such a way that the drug only releases certain quantity at a given point in time. So we have a controlled release drug, we have a sustained release drug or preparations and all that. The drug has been designed in such a way. So sometimes if you tell you to swallow a drug, then you chew. Sometimes when you chew, you disrupt with the formulation. So instead of the drug maybe releasing certain quantity at each point in time, you are crashing it. So that formulation has been spoiled. Then you end up sometimes getting high quantity of the drug in your system, leading to adverse effects and all that. So we must sometimes adhere to what maybe the pharmacist or what has been written on the drug. If you say swallow, we know why you are telling you to swallow. If you tell you to chew, we know why you are telling you to chew. So please, let's be careful with all these things. Okay. Then this leads us to what we call bioavailability. Bioavailability. What is bioavailability? I like this term a lot. What is bioavailability? I remember telling you people to go and find out what bioavailability is. So what is bioavailability? It's the term used to describe the fraction of the administered dose that is absorbed into systemic circulation. This means that the quantity of the drug that gets into systemic circulation. So you swallow the drug, what quantity of the drug now entered into the systemic circulation. And I think we tackled this in the first video. So if you have forgotten, please go and revise. So bioavailability is a fraction of the administered dose that get absorbed into the systemic circulation. Bioavailability of some drug is affected by the presence of food. Example, penicillin, erythromycin, rifampicin, all these drugs, they are affected by the presence of food. So there are times we tell you, don't take this drug with food. And there are times we tell you, take these drugs with food. So please, let's take note. Some drugs are taken before meal to allow time for drug to act before food is taken in. So some drugs are taken before meal to allow the drug to act before we take in food, and some drugs too are also taken with food. So please, let's take note of all that. Okay. Then gastric irritation can be caused by drug taken on an empty stomach. So we have reasons why we tell people not to take certain drugs with food and also to take certain drugs with food. Okay. Then first pass effects, and I know we tackled this in the previous videos as well. First pass effect. When we say first pass effect, what do we really mean? Maybe before a drug gets into the bloodstream, especially by oral means, the drug will have to go through your liver before finally ending up in the bloodstream. So when the drug goes to the liver, some parts of the drug is metabolized and taken off. So if you swallow, let's say para 1 gram, by the time the para ends in the bloodstream, part of the para will be metabolized. So you don't end up getting 1 gram of para in your bloodstream. So first pass effect is when the drug passes through the liver for metabolism before eventually going to systemic circulation. So let's say, so just look at this diagram over here. Look at this diagram over here. This is your GI tract. So when you take a drug, the drug going to the GI tract is absorbed through the portal circulation. So this is your GI tract. So the drug will be going through here. The drug, some of the drug will get absorbed into the portal circulation. Then when the drug gets into the liver, part of the drug will be what? Metabolized. Part of the drug will be metabolized. Then finally, you end up getting some quantity of the drug. So this is all what I'm trying to say. So first pass metabolism, the drug will go to the liver before ending up in the systemic circulation. I hope you get what I'm trying to say. So let me see what I can do. So let's say you have a drug here. So this is a drug. The drug here going through the GIT. So let's say if the drug is para, then it's 1 gram. Let's say it's 1 gram. When the drug is going through the GIT, what happens is there are enzymes in the GI tract that sometimes metabolize some of the drug. So once the drug leaves the GIT and also enters into the liver, we have enzymes in the liver that also break some of the drug off. Then finally, the drug will now come and end in the general circulation. So first pass metabolism reduces bioavailability, or it reduces the quantity of the drug that eventually reaches the systemic circulation. And I hope we all get it now. Okay, so now let's move on to the next thing that we'll be looking at. So the next thing is we are done with pharmacokinetics. So the next thing that you'll be looking at, pharmacokinetics, not that we are done. We are done with what? Absorption. So we'll be looking at distribution, excretion, and metabolism. And you think we are done. We are not done. So please stay tuned for the next video. And I hope